Guys, and welcome to Ketta's Perspective. This is my first YouTube video, so be kind. I just wanted to hop on here and create a channel, especially since I recently became a certified nurse practitioner as of yesterday. So I wanted to come on here and give some tips on how I was successful and how I think you can be as well. So I'm holding two books in my hands. These are the books that I used to prepare for my boards. I used the Leak Intensive Review Certification book. Up a little bit so you can see it. It is the 4th edition. It's the most current edition for 2021-2020 information, and it's awesome. It comes now with a new updated website. That's very interactive, has tons of questions, I think like 700 questions, every single body system. This is good for the AANP and the ANCC exams. I took the AANP for adult gerontology nurse practitioner, but this is essential for either one. So yeah, I use that one. And then I use the Fitzgerald. I actually did Fitzgerald's live NP adult gero review. I did it online. It was 2 days. It was streaming via Zoom. And that was really great too. I did that probably like 2 to 3 months prior to graduating my program. And that was essential. And I also used this book, the Nurse Practitioner Certification Exam Prep. This is actually by Fitzgerald as well. This is the 6th edition. This dives deep, guys, into content. This really will help you if you're struggling to understand a disease process in depth. This is a really good resource. I used this first, and then I used the Leak to just kind of refresh my memory. So honestly, Leak, by the time I did this, was just a review and honestly just a test of my knowledge to see if I really was comprehending the information that was being given to me and that I was reviewing. So that's all I used, Fitzgerald and Leak. Some people use Amelie Hollier. I have some colleagues that have used her and I've heard great things about her. So I would use her as well. The only thing I'd say with Fitzgerald is that it goes so much more in depth than Leak. So you really don't need that much depth as an entry-level NP. So I think Leak is probably all you need. And after using her information, I found it to be invaluable. Like I absolutely loved it. I loved the layout. It was to the point. Every disease process was just, this is what you need to know. These are your do not misses. She has exam tips that she'll present to you in each chapter, clinical pearls, which are really helpful when you start practicing. So I just cannot say enough good things about her stuff. So excuse me, I'm a little disheveled. It's my first YouTube video. I'm not a professional. You know, I'm new to these YouTube streets. So I made a little list of things that I think were super important topics that, you know, you should review when you're taking boards. I mean, granted, if you read the Leak book from cover to cover, you'll be fine. But these are just things that I saw that were highlighted. And these are things I think that are important for a new entry-level nurse practitioner. So definitely study. I studied for 6 weeks. And everybody thought I was crazy, but you need to put in the time. Whatever your weaknesses are, focus on those. If you're strong in an area, don't dive too deep into that. You know, just do that as a refresher, but definitely study. I'd say 4 to 6 weeks, and especially depending on how your program was. My program did not prepare me as much as I was hoping, so that's why I studied so extensively after graduation, because I felt like this is a one and done for this exam. I'm not taking it twice. I need to start working and I just need to get this over with because my anxiety is through the roof. So study. I said use Fitzgerald and Leak, but feel free to use, you know, Barkley or APA, Amelie Hollier. I think Barkley is a little more difficult than boards. I actually used Barkley to prep in school. I did horribly on their exams. I just found them very difficult. So I would not recommend using Barkley, especially if you're going to take the AANP, maybe the ANCC, but for the AANP, I don't think you need Barkley. And I don't take their results that seriously because they kept telling me I was unsatisfactory, and I did not, that was not the case. obviously I passed my boards and I'm competent enough to be an entry-level NP. So don't take that, super seriously. Take it with a grain of salt. Those tests are designed to be extremely difficult for some reason. I think that's probably the best bet for them to be difficult. So you'll be more prepared for boards. I don't know. But like I said, don't even bother with Barkley. If you're taking the AANP, don't take it seriously. Just do Leak. Leak is the holy grail. Okay. She is the GOAT. So I would do that. The APEA, I did one of those pre-predictor exams. The same thing. I scored horribly. And I was like, oh my gosh, this is just killing my confidence. And then I would do Leaks practice exams. And it's not that they're easier, it's just worded differently. I think maybe I understood it better. So Leak all the way. Those pre-predictor tests, don't waste your time on those. They will just kill your confidence, okay? Nobody knows everything. So don't even stress if you don't do well on those. I would do tons of questions, tons of practice exams if you can. I probably did over 3,000 questions between Fitzgerald, Leak, and I did some Barkley. I did like one Barkley exam because I had it from school. So I would do tons of practice questions. And with the practice exams with Leak, I would recommend doing them with her because she simulates like test day. So she'll have a timer up there, 3 hours for AANP, 4 hours for ANCC. Try to do it in one chunk of time and simulate like you're on your test day. So that's what I would recommend. And her exam is very, very similar to what you're going to see, like this, how they ask the questions, everything. Like it just seems more like your test day. So I would do that if you're doing AANP. I say Leak is the way to go for your practice exams. And honestly, I only did 2 of her practice exams because she has 4, but 2 of them are AANP and 2 of them are ANCC. So I did the ones obviously that were geared to the exam that I was going to take. I would simulate your test day. I did that probably 2 weeks before, and I just kept doing it like a week before, or like I just kept running through everything. Like definitely have your scrap paper memorized. What do you want to put on your scrap paper? Because they do provide that to you. Do you want to put your murmurs? I did that. Do you want to put your Tanner stages? I did that. I put high intensity statins because I could never remember those. Do you want to put the asthma step levels? If you can remember all those, just to help you. The COPD guidelines, like things that are purely memory based and things that you just have to know, put that on your scrap sheet. If you have any issues remembering anything, put it on your scrap sheet. I also did the Tanner stages and then like the Renee and the Weber test. So just put anything on there that you feel like, okay, this is strictly memory and I had issues remembering this in school or for board prep, put that on there. Just literally brain dump on your paper, but plan out prior to your exam what you want to put on that paper because you want to use all your time very, very carefully when you're on boards. Please excuse my nails. I'm going through it. I'm a new grad student. I'm broke. But anyway. I would say also to get enough sleep the night before. That is essential. Get enough sleep, guys, because that's invaluable. You're not going to think as clearly if you're exhausted. That's just how the brain works. So definitely get enough sleep. I think get enough sleep a couple days before. And Leak, in her first couple chapters, she will walk you through like how to prepare for boards, how to prepare for the day before, how to prepare for the night before. She will walk you through down to what to eat the day before test day. And I took everything seriously. Like, guys, this was strategic. Do not leave anything to chance. Okay, this is your future. Don't leave anything to chance. Plan as much as you can. You can't control every circumstance, but you can control how you react to the circumstances and how you'll do on test day. You can't control the test, but you can control how you react to the test and how you prep. So I would definitely do that. Eat a balanced breakfast. That sounds very simple, but you should. I ate 2 eggs. I ate some turkey bacon. I ate some toast, an orange, and a small amount of juice. And I took my test at 10 a.m. and I finished about 1:30-ish. So, and I was not hungry. I was not hungry during that whole time. So you definitely want to choose a meal that's going to keep you full. The last thing you want to be worried about is your rumbling stomach when you're taking a test and trying to concentrate. That's going to distract you and it's going to affect your cognition because Maslow's hierarchy tells us that's our base need. You need to fulfill your physiologic needs before you can fulfill your cognitive needs. So if you're hungry or you're sleepy, you're not going to perform as well. So, and I've seen other YouTubers that have made these videos and they've said that, and I also did that too. I watched a lot of YouTube videos from other YouTubers that talked about their experiences passing or failing. I watched both and I took what they said very seriously. And I'm new to YouTube, but I'll try to link below the videos that I watched. And shout out to those YouTubers. I found your videos very helpful, very, very, very helpful, very informative. And I took that to heart, what you guys said. Like I took all your tips to heart. And I feel like I really, really was successful because of what I learned from you all and the resources that you've used and just, you know, how you prepared for test day. So I'm trying to pay it forward myself and, you know, help other people because it's definitely possible, guys. You got through grad school, you can do this. It's possible. It's not hard. It's not hard. It's just strategic. You got to plan, you got to prep. If you don't prep, you know, so. Okay, and I would say breathe, guys, breathe. During the test, like I had to center myself. I just had to like, okay, I'm on question 86. Ooh, you know, my brain's getting foggy. I'm getting tired. It's like breathe. And if you need to use the bathroom during the test, do that. Don't sit there and think you have to power through. Do that. If it's going to take you 2 or 5 minutes and it's going to help you feel comfortable and focus, do that. That's what I did. I had to pee halfway through and I was like, oh, should I power through? I was like, no, I can't concentrate. All I'm thinking about is having to pee. So I went to the bathroom, used the bathroom, splashed some water on my face, and came back and I felt refreshed. Like I felt like, all right, round 2. So definitely do that. It may have taken me 5 minutes. You know, your clock will still be counting down. So don't be in there for like 15 minutes, giving yourself a pep talk. But, you know, definitely be mindful that the clock still continues. And when I took my break, I still had an hour and a half left. So I was like, all right, I can swing 5 minutes. I think I can do that. I need to urinate. Like, I just gotta go. You know, be prepared for test day. Have your 2 IDs. For me, I had to have 2 IDs with the signatures on them. I had to have a mask and gloves. Y'all, they made me wear gloves to take my boards. Like literally, I was so hot. I was in a mask and gloves. I felt like I was in the COVID unit. Like, why am I wearing gloves? Like, I'm the only one touching this computer and you can clean it when I'm done. But all right. Yeah, so the testing environment was a little uncomfortable and I wore long sleeves. I thought it was gonna be cold. So I was just like super hot and anxious and sweaty. But you know, so just try to find out too, like what your testing center requires, because I didn't know they required gloves till like the day before or the day of actually. So, but they will provide you gloves or mask or whatever, because if that's their rule, you don't know. So yeah. And I had to sign a testing agreement to go there and like agree to like not share, you know, things. And obviously I'm not going to do that in this video. I'm just telling you like basic concepts of how to be successful on this exam. So that's fine. No issues there. But yeah, and pace yourself with the questions. Pace yourself. They say give yourself a minute per question. Honestly, I don't think that's realistic. Not all these questions are going to be that simple. So if you need to give yourself 2 or 3 minutes, do that. But if you feel like, okay, this question is taking me too long, like I've been on this question for a while, bookmark it, choose something, bookmark it, and come back. Trust me, that will help you a lot because I realized that I was taking too long. I bookmarked it, kept it moving. I was like, click, all right, I chose something, narrow it down to 2 answers. Don't just choose something randomly. It'll save you time. Narrow it down to 2 answers. And if you're not sure which one, pick one of the 2. Then come back and really go through and dig deeper into that question. Don't just pick it at random because that's going to waste you time and then you're going to have to reevaluate the whole question again. So that's something I would say. Narrow it down, pick one of your 2, move on, come back to it later. And bookmark judiciously. I may have bookmarked maybe 6 questions. Like I really didn't bookmark a lot of them. Just bookmark the ones that really stumped you, like the ones that, okay, this is giving me a lot of information. I really have to critically think on this one. Don't bookmark something that's like, oh, what's the best beta blocker for, you know, this condition? You know, don't bookmark something that it's just like common knowledge, something that's, you know, easy to recall. Bookmark the really hard ones that are like asking you to diagnose something or something that you just really stumped you. Because chances are, you know, while you go through the test, it may jog your memory. Another question may jog your memory and you can come back to it and say, oh my gosh, like I remember now what the information is. I remember, you know, a little bit more to help me answer that question. So I would do that. Quick note for the AANP, lab values are provided for you in a question if they are pertinent to that question. So don't memorize your lab values, guys. It's not gonna help you. You know, save that brain space for things that you just have to remember. You know, don't worry about the lab values. They will be provided for you. They will be there. If they're pertinent to the question, they will be there for every single question. That was one thing I absolutely loved. It was, whew, thank you, AANP, because that was one less thing I had to worry about. So questions that I saw on the exam, types of, not even questions, just topics that I saw that were like heavily tested. But I'll talk about that now, but just know the leak book. Literally, if you go through the leak book cover to cover, you'll be fine. But these are things that I think they think are important as a certifying body. And it makes sense if you think about it, you know, your danger signals, your do not misses, things that are like could really affect someone's life. You know, their ultimate goal is to make sure you're going to be a safe entry level nurse practitioner, as they should. They were hard. Some of them were very hard. Some of them were very easy. So it was just a mixed bag, guys. It's just all over the place. It's literally like what you would see in clinic. Some patients are going to come in with a very classic case of something. Some people are going to come in and they need to go to the ER. So it's just like that. Just think of it as this is a clinical day and I'm seeing 150 patients, which is a long clinical day. I'm seeing 150 patients in 3 hours and I need to diagnose them, treat them, figure out what's going on and move on. Literally, that was my mindset. I'm like, this is not a test. This is my clinical day. And I think that really kind of helped my nerves too. So derm, I saw rosacea, erysipelas, acne, basal cell carcinoma, Lyme disease, and actinic keratosis that I can remember. And these are all things that are super important, super common. And you know, your carcinomas, your basal cells, like you don't want to miss those. So I understood why they asked those. So definitely know derm. I saw a lot of derm, and derm was my weakness back in the day, back in, you know, grad school. So I saw subungual hematoma and molluscum contagiosum. Thank you, Leak, because I did not know what that even was until I like studied her book. And I saw Candida albicans, super random. Hypertension, know your guidelines, guys. Know your guidelines. Know your ACC, know your AHA, know your first line meds to treat hypertension based on ethnicity, based on kidney function, etc. And also know like, okay, if this one isn't working, what should I add? What's the next step or what have you? Definitely know that. No metabolic syndrome, no arterial disease. What else? No basic EKGs. And most of us nurses do know. You know your AFibs, you know, your anterior MIs. I had AFib. That's pretty textbook AFib too. So know that. I only had one EKG strip. ENT had a lot of chalazion, no hordeolums. Okay, where were we? This video is getting a little long. Okay, so hordeolum, chalazion, know your eye emergencies. I had an eye emergency on there and I was just like, oh, wow. I think you should go to an ophthalmologist. I don't know, you know, but know those. Know when they need to see an ophthalmologist or go to the ER. And that's another thing, you know, emergencies are really, you know, really critical that you can identify them. So I understood why they asked me that. Know your glaucomas, important. No macular degeneration. No strep. And while you know strep, you should probably know mono too, because honestly, they could coincide. The patient could have both, so just know both. No diabetic and hypertensive retinopathy. Know those differences. That was something that was really hard for me to understand because there are differences. I just couldn't remember them. So that could be something too that you put on your scrap sheet. Just know those differences because that will come up. Okay. Respiratory, no COPD, know the treatment guidelines, no asthma. I didn't personally have any asthma questions, but you should know the steps. So that's something too you could write down on your scrap paper. That was just always hard for me to remember. No pneumonia. And while you know that, know how to treat pneumonia. Know how to treat pneumonia in a healthy patient and know how to treat pneumonia in a patient with comorbid conditions. That's vital. And know how pneumonia presents, know how it presents on a chest x-ray, know how it presents when you're examining someone. Endocrine, no diabetic meds, know all the diabetic meds. That was a shock to me. I was like, oh snap, they're asking me about diabetic meds. And it gets a little dicey when it's like the SGLT2s and the DPP4s, and they're so similar, but you know, and it's like the sulfonylureas and you have to be careful with their GFR. So I don't know about that question, but know that. No hyperprolactinemia. I saw a little bit of that. No hyper and hypothyroid. Those labs will be provided for you. but know what the labs mean, know how to interpret the labs. I mean, just because they're there doesn't mean they're gonna, obviously tell you what's going on. So you have to know how to interpret those labs. And know how to reassess the med effectiveness of pretty much all these conditions. No metabolic syndrome, know how that presents, and no Cushing's and Addison's. I know that sounds crazy, but I had those. I had Cushing's and Addison's, and I was like, wait, what? Yeah. As for GI, no GERD. GERD is the word, okay? Know that, because just about everybody got GERD. No Barrett's esophagus, know when to refer that out, and no danger signals for esophageal cancer. Vital. No diverticulosis, diverticulitis, know that. No colon cancer, no cholecystitis, no appendicitis, no all the itises, know all that, okay? Because chances are you're gonna see that. If it's not on the boards, most likely in clinic. So it's just, a good idea to be familiar with how that presents. GU, no rhabdo. Statins are usually the culprit, typically. No UTIs, no first-line treatments for UTIs. Know how to treat pyelo, complicated UTI. Know how to treat a UTI in a pregnant woman. I didn't personally see that, but that's something you should know. That's huge. Know how to interpret a urinalysis. That's vital. Like I said, they give you the labs. They're not going to tell you what's going on. They're going to tell you this is what the patient presented with. These are the labs. What do you want to do about it? Or what's the diagnosis? That's pretty much how boards. It's like literally their questions are cut and dry. It's just like they're not super long. They're just like, but it doesn't mean they're easy. And that's the thing. Like you look at them and you're like, oh, this question isn't long. It's not going to be hard. No, some of them are really difficult and they're like maybe 2 sentences. So know that. Know your kidney labs, your EGFRs, your gold standard for kidney function, know your creatinine BUN, know those. Other than that, I mean, nervous system, know your headaches, know all the headaches, know multiple sclerosis, and know how to distinguish that from myasthenia gravis because that took me a while. Know temporal arthritis and know the sequela of temporal arthritis. Okay. Know Bell's palsy, polymyalgia rheumatica, know that, and post-herpetic neuralgia. That was important too. Know hematology, basically literally all the anemias, like y'all, all the anemias. And they'll throw you with like demographic information on the patient and it's like, wait, what? It's sometimes not even pertinent, so don't let that distract you, but know your anemias because they're going to give you the labs. Sometimes they're not even going to give you all the labs. They're going to say reticulocytosis, or, they're just going to give you like the definition. And you're like, wait, what? That was literally me. And you literally have to like dissect it and just work your way through. Sickle cell anemia, it's all a bit of that. Musculoskeletal, know osteoarthritis and rheumatoid arthritis and know how to differentiate those two. You have to. Know low back pain, know when you need imaging, because I had a question and I was like, I don't think I need imaging. I think this guy's okay. Like, there were no bad neurological signs or anything like that. So don't just do a test just to do a test. Don't do it because you think they want you to do something. Sometimes the treatment is watching and waiting. Sometimes the treatment is conservative, and that's okay. You don't want to charge this patient $2,000 for an MRI that's not going to change their treatment. It's not going to change their outcome. It's not going to change their symptoms or make them feel better because an MRI is just going to tell you what's going on. It's not going to change how they're feeling. So this guy, he don't need an MRI. So hopefully that was right. Anywho, no gout. Gout. Okay. Know how to treat gout. Know how to diagnose gout. Know which type of gout's the most common. Yeah, that showed up. Know your NSAIDs. Know the adverse reactions from NSAIDs. Know what NSAIDs can cause. Typically cardiovascular issues, GI bleeds, etc. Know that. Know your COX-2 inhibitor, Celebrex. Shocking, Celebrex. Know that. Osteoporosis. Know that. Know how to treat it. Know who to screen for it. Yeah. DEXA scan. Know how to interpret those results. For sure. Ankylosing spondylitis. What? Thank you, Leak, because Fitzgerald did not cover that. Leak did. And that's another thing too. I used both these resources. They don't all cover the same things. So I feel like Fitzgerald was okay, but Leak did me a solid with covering things that were not covered in Fitzgerald and things that showed up on my test. So when I saw stuff that I studied in Leak, I was like, oh my gosh, thank you. Thank you, Miss Leak. No bursitis and no lupus. Psych, know your atypicals. Just know the classes of your psych meds, like you really don't, and know like some of the side effects. No suicide and depression. Honestly, I didn't see too much psych, thank gosh, because psych is one of my weak areas. So male reproductive, no testicular cancer, no epididymitis, no transillumination, and which diseases present how with transillumination, know that. No PSA, no prostate cancer, and erectile dysfunction. Like I said, this isn't all inclusive. This is just from my experience. So, but these were things that, were asked of me. Paget's disease of the breast. They asked me that, I don't know. So look that up. No ovarian cancer. Anywho, no STIs and how to treat them. I had maybe a couple STIs. You should know amenorrhea and, some labs that you'd run for that, what would cause it, etc. And menopause. You should know like what's not normal in a menopausal woman, things like that. Pretty much. I didn't see a lot of contraceptive questions, which I was expecting. Like contraceptives were a weakness of mine until I did my OB rotation my last semester, my OB clinicals, and that really helped put the pieces together and actually did help me a lot on my boards from seeing like some other things. No cervical like neoplasia, no like when to do a colpo, no, cervical cancer screenings, things like that. I don't remember the exacts of those, but know your screenings. Because guys, we're in primary care, like we have to know how to, why we're screening our patients and when to do so. In general, for like the elders, no elder abuse. That showed up, which I expected that to show up. That's important. Dementia showed up a lot. I felt like I had dementia because I forgot. It was a lot. Like Alzheimer's showed up. Like I was like, oh my gosh, I forgot like about that. Parkinson's, essential tremor. I was like, oh wow. So like I said, the list is not all inclusive, but those were things that I thought were, important to know, and things that I personally saw. But yeah, that's it. I hope this video like helps someone. If you have any questions or comments or, want to share how your experience was, you can put the comments below. Click like, subscribe. I can use all the subscribers right now. I'm new, and thank you so much for watching this video. Have a good one. Bye.